Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Today I want to do an update on N-acetylcysteine. NAC is an incredibly important and very, very powerful precursor to the making of glutathione, which is one of our endogenous antioxidants. So NAC in and of itself has antioxidant property, and it does so much besides just helping to support natural production of glutathione. It certainly targets inflammatory cytokines, so the pro-inflammatory cytokines. It targets bacterial as well as viral infections and has been looked at in terms of targeting H. pylori in particular. We certainly know that it can help to downregulate NF-kappa beta, which is one of the master regulators for inflammation in the body. And we also know that it can help to enhance or improve upon insulin sensitivity in the body. So for people who have metabolic disorders, including prediabetes, diabetes, that NAC can be very, very helpful for this. We also clearly know that when it comes to different areas in the body where oxidative stress is more pronounced, say, for example, after exercise, and we get a lot more oxidative stress within the tissues, that NAC can be very, very beneficial. So I want to talk about NAC and kind of revisit it because a lot of attention in the offshoot scientific community has been looking at NAC in the setting of COVID-19 as a potential treatment option. So I want to kind of give some updates on some of the science that has come out on that over the last couple of months. Initially, when the pandemic first started, a couple of months in, they started looking at NAC because they knew that NAC had targeted other coronaviruses in the past, including the Middle Eastern respiratory syndrome, and they were seeing the potential benefit in terms of a utilization of NAC in those settings. So when COVID-19 came out, of course, those same researchers, as well as many others, started to look at NAC as a potential treatment option as well. So I want to give you the update on all of that and talk just in general about NAC because I just think it's absolutely fabulous and it does so many wonderful things for our body, and there's so much science that validates its utilization in terms of a supplementation. So I am Amanda Williams, MD, MPH, and let's talk about NAC. So some people shorten it and just call it NAC, but we know that N-acetylcysteine is the precursor for the primary endogenous antioxidant in the body, glutathione. We have known for a very long time that NAC can help to loosen the thick mucus in the lungs when people have COPD and other respiratory issues. So for a lot of people who deal with seasonal allergies, oftentimes adding NAC into their routine during that time can be very, very helpful because not only can it help with the thinning of the mucus, we also know it's targeting those inflammatory pathways. So often when we're dealing with seasonal allergies or any type of a respiratory issue, we're dealing with increase in inflammation. So we know that the NAC can help to tamper that down. Now, for many, they may know NAC as being the antidote when someone takes too much acetaminophen or Tylenol. And so if you overdose on acetaminophen, the way to try to save the liver so you don't go into acute liver failure is to give high-dose NAC. We have now been able to see how NAC is also working within the immune system, and that is kind of evident and clear when we look at the way that NAC can help to regulate different genes, which I think is really quite interesting. And specifically the way that they have assessed NAC being able to target H. pylori, which we know is that very miserable bacterial infection that is the number one cause for the peptic and duodenal ulcers as well as gastric cancers. So I think that that's something worth notating. But we do recognize that NAC also is very targeted when it comes to different viruses. So influenza is one area certainly that they have looked at, and they found that NAC treatment of influenza significantly decreased the frequency as well as the severity and duration. So when looking at it in that regards, they thought, well, we should probably look at it when it comes to COVID-19 patients, and that's exactly what they have been doing. So in October of this year, there was a basic synopsis or an overview that was published in the Medical Hypothesis journal talking about NAC as a potential therapeutic agent for this very unique SARS-CoV-19 virus, and talking about how the lowered immune function, led to an increase in the risk of the disease severity, certainly looking at, the different viral loads and looking at high levels of inflammatory markers such as TNF alpha, interleukin 6, interleukin 10, which have all been indicated. And so when we get an overproduction of these in the body, then we have that cytokine storm, as they refer to it as. So being that they know that NAC can target these different mechanisms by which inflammation is driven up in the body, they started to really look at NAC as a potential when it comes to a treatment option. So in this particular study, that's what they were doing. They were hypothesizing that NAC could actually act as a therapeutic agent in the treatment of COVID-19 through a variety of different mechanisms, including increasing the glutathione, which we know is going to be beneficial, improving T-cell response, and we're looking at our innate and adaptive immune system, as well as modulating inflammation. So, that's one area that I think is quite notable, is that NAC is not just you take N-acetylcysteine and it helps the body make glutathione. It's doing many other things. Now, the Department of Health Sciences at the University of Genoa in Italy, they were looking at the rationale for using NAC in not only the prevention but also treatment for COVID-19. And through their research, they focus a lot on the cytokine storm and this systemic inflammatory response that is brought on by an overreaction from the immune system due to COVID exposure. And looking at the oral administration of NAC, they said is likely to attenuate the risk of developing COVID-19. Now, why would that be? Well, certainly because we're lessening inflammation in the body. At the same time, we're heightening the immune system's ability to kind of be at the ready. And I think that this is another area where they have shown once again that NAC really does have this power about it. And it makes sense for me. I've followed research on N-acetylcysteine for a very long time when it comes to cardiovascular health, when it comes to treatment for different addictions, for example. So we know when we're talking along those different gene levels, for COPD, clearly we know that NAC is really, really very beneficial, but we have also seen how NAC can, cross into, the blood-brain barrier and be beneficial even in the setting of neurodegenerative disorders. So, but it didn't surprise me that a lot of the science went this way when COVID-19 came out, because when we look at a lot of the immunopharmacological studies done with N-acetylcysteine, we have seen how it actually could protect the lung from significant damage from other types of viral infections, including like swine flu, for example. And so we do know that NAC really does pack an awful lot of punch, which is why we just wanted to kind of revisit this, because many times people will ask, well, why would I take NAC? And I always say there's a lot of different ways we can answer that or unpack that question. We can look at liver health, predominantly, and that's the primary reason as to why many people would look or turn towards supplementing with N-acetylcysteine would be because of the metabolic detoxification process and helping to enhance that glutathione. Like I said, if that's your primary treatment, if someone ODs on Tylenol or acetaminophen and NAC is good enough for that, then we know NAC, in terms of supplementation, is going to be incredibly supportive for everyday detoxification of the body. So that's one area for those who have respiratory concerns, whether it's you've been diagnosed with COPD or you are succumb to seasonal allergies or you have a history of asthma. There's a lot of different ways in which respiratory function can be improved upon from adding in N-acetylcysteine. So then we look at the bacteria and we look at the viruses and we say, oh my goodness, this, NAC really does so much. And one area of current research is there is actually a couple of clinical research trials where they are using NAC in the setting of COVID-19 patients to try and see what that response rate is actually going to be. And as we know, even, basically a year into this pandemic, there's not one, single just direct treatment option. So they're always continuously trying to find something that could potentiate a benefit. And obviously it's going to vary from one person to the next as to what someone's, technically going to respond to. But in the current Pharmacological and Biotechnology Journal, just a couple of months ago, they came out and they were talking about the mechanism in which NAC seems to be targeting COVID-19. And this is the area that I found really quite interesting, because they said that their findings from what they've been assessing over the course of the last year is that NAC may have this therapeutic effect on the pathological targets of COVID-19. And the way it's doing it is targeting TNF alpha, so tumor necrosis factor alpha, interleukin 1, interleukin 6, interleukin 8, interleukin 10, interleukin 17, and they're seeing that those levels, when they have NAC on board, those levels come down, which is really quite important. Now, the other thing that they have looked at is the antiviral effect that NAC is having on COVID-19 specifically. So they already knew it was working in, swine flu and influenza, and targeting bacteria such as Helicobacter pylori. But seeing that it was actually working in this setting as well with this novel coronavirus really was quite interesting. Now, the most recent study that I went through and assessed on NAC was in the Journal of Therapeutics and Clinical Risk Management, talking about NAC to combat COVID-19. And this was a full kind of evidence review type of a report where they found that NAC functions as an antioxidant, an anti-inflammatory, and immunomodulating nutrient. And all three of these characteristics, when you combine them together, may prove to be incredibly beneficial in not only the treatment, but also the prevention of COVID-19. And through this particular study, they kind of got into some of the details of, looking at that cellular level, looking at the neutrophils, talking about that cellular immunity and what's actually required to be able to fight off a viral infection, and recognizing that when NAC was on board, that many of those pathways were much more able to handle the COVID-19 infection. So theoretically, NAC has this potential to basically inhibit the SARS-19 because of its ability to downregulate primarily NF-kappa beta. So I know there's a lot of different names, the TNF-alpha and NF-kappa beta, but these are all major drivers for inflammation within the body. So if we can downregulate, and this is when we talk about the immunomodulating property of NAC, if it can change basically the redox balance in the body and it can suppress NF-kappa beta activation, then we are seeing this really formidable force of NAC. And then it can also target the reactive oxygen species. So when we think about all of the free radical assault that can actually occur at that cellular level and do significant amount of damage. So right now what they're trying to figure out is, is IV NAC the choice? Is it going to be oral NAC? And obviously, depending upon the severity of someone's COVID symptoms, there's going to be a lot of variations in terms of route of transmission of giving someone the NAC. But I think for right now, the most important thing is that through this last year, what they continue to show is that the benefits of NAC are really quite remarkable, and being able to mitigate that inflammation and the tissue injury, that NAC administration in combination with some of the other antiviral agents may drastically and dramatically reduce hospital admissions and the requirement that someone would maybe get to have to be on a ventilator. So this is something that I'm going to just keep giving you updates on, because for me, NAC is just a really novel supplement to be on, and for so many different aspects of our overall health, for brain health, for heart health, for lung health, for immune health, for just the support of our cellular DNA. There's so many ways in which NAC can be really, really beneficial. If you're not sure as to how to take it, when to take it, then you'd want to reach out to one of our healthcare experts at any of our locations, and they would be happy to walk you through all of those different steps. And it really can vary from one person to the next. For some person, maybe they need 1,200 milligrams per day. For someone else, maybe it's 2,400 milligrams per day. So there's going to be some variables to that, but definitely don't overlook NAC in your everyday routine when it comes to just overall wellness, but also for immune system support. So that is all that I have for you for today. I want to thank you so much for tuning in to the Invite Health Podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts, or by visiting invitehealth.com/podcast. Do make sure that you subscribe and you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health Podcast.